What's up everybody, I'm Dr. Winters and we're back with another crazy video. That's right, you guys tag me every week in all the craziest dental videos online and we react to them and hopefully you'll maybe learn something too. In today's video we got crazy braces appliance all the way to what an overbite really is. That's right, I bet you've been calling it wrong your entire life. So let's go ahead and get right into the videos. Alright, ooh, the dreaded palatal expander. Oh, you know, I used to dread these things because I was like, what if you slipped and you end up just like stabbing the back of the throat? Because like you have to push it back towards the throat to actually turn.
There it is.
Oh my gosh, this brings back some memories. If you guys don't know, each turn, see, she almost got him in the back there. Each turn is 1/4 of a millimeter, and that will expand you out 1/4 of a millimeter at a time. All right, and see, she's going back in for the second turn, and you can see just how crowded she is there. And so each of those turns is to expand out the upper palate of the arch to make room for some of those crazy crowded teeth that she's got. She's got 2 whole blocked out teeth there. Oh, don't hit the back of the throat. Every time. I was always so worried, and then you have to pull it down and get it out. Now, even though she looks like she's really in pain, she's not. It's not really painful at all. You just feel pressure on your mouth because, I mean, it is such a small amount. And fun fact, sometimes you'll see a giant gap right in the middle of your teeth because your actual jaw bones, yeah, they literally go away from each other. They even make your nose a little wider too. It's basically like doing a jaw surgery without doing a jaw surgery. It's actually kind of cool. You can see the little white line in the middle of her roof of her mouth. That's actually that mid-palatal suture that actually goes apart from each other. Now, if you wait too long and you get too old, that suture, the bone will actually fuse together and you can't do it, and you have to go and do what's called a SARPE, a surgically assisted rapid palatal expansion. Let's see what the comments had to say. Oh my gosh, this person said, my mom used to forget to turn mine for a few days and then turned it 10 times at once. Definitely don't recommend that. At that point, you're probably moving from pressure into some slight pain there. Yeah, we just tell people to really like turn it 1 or 2 times a day. Someone else said, had mine for almost a year, worth it in the end. It was this or have a palate surgically modified. And that's what I was saying. It's like a jaw surgery without a jaw surgery. It's pretty awesome. Oh my gosh, this person said, I used to turn mine like 5 times a day to speed up the process, even though I was only supposed to turn it once. Yeah, don't do that. That would be a bad idea because we know exactly how many turns we need to get your teeth over to where they need to be. And if you're overturning, you're gonna come back and your teeth are gonna be completely out of there and you're gonna have a huge bite issue. So maybe don't do that. But if you do get this, don't worry about it. It's not that big deal at all. Now, one thing you guys see a lot is gaps. That's right, gaps between your teeth. And sometimes people decide to take that into their own hands and see if they can close their gap themselves. So this guy decided to do it. Let's go ahead and see exactly what he did and if it was a terrible job or not.
Okay, so this is part 2, closing my gap in 1 week. So I put the rubber band on, and then I put the other 2 rubber bands.
So first, I'm gonna stop it here, see exactly what my man's got going on. So it looks like he's placed some brackets himself in a quite interesting position all the way down at the very edge of the teeth. Actually, not too big of a deal because that's gonna tip him this way. And then it looks like he's putting loom bands or some type of rubber band around each of them.
Each side, so they can all
close.
He's
doing the 2 on the outside, 2 on the inside.
The middle do move, and this is me at the dentist.
Okay, so before he shows us the result there, we got to talk about it. Now, there's a certain reason why we go low and slow with braces, because if you move your teeth too fast, you can actually cause bone loss around the teeth, which is one of the issues we do see with people who use these loom bands to try and close up, especially big gaps really quickly. We see some issues. Another issue is he's really just tipping the teeth. So instead of them closing together like this, he's pulling them and they're just kind of tipping together like that. So they will go back really quickly unless he gets some type of retainer to hold them. And the last thing that I can think of is that even though he's putting these on there because he said he didn't want any gaps in the middle, and we see this a ton where somebody has a big gap in the middle, they close it, and then all of a sudden there's a gap on the 2 here. So then he put more on there to close even more teeth, but the problem is there's still gonna be a gap between his canine and the laterals. That space has to go somewhere unless you're in full braces. So those are the 2 issues that I see. So let's keep going.
Yes, as soon as I got them exactly where I wanted.
Okay, so it does look like he did close the gaps in the front that you can't really see it, but he does have 2 gaps right here. He has to. Those spaces have to go somewhere, and it looks like he's in a dental.
I got a permanent retainer behind my teeth, and this is the way it looks. You can't tell me that looks fucking
okay. So I'm not gonna lie. In this weird one-off scenario, they do look pretty good, and it does seem like it works. Now, that being said, for other people with bigger gaps and bigger problems, I definitely wouldn't do this yourself because a lot of harm could be done, especially if you don't know what you're doing. Also, it's very interesting that he got into a dentist and a dentist actually allowed him to put a permanent retainer on that. A lot of the times if you're doing self-dentistry on yourself, a lot of dentists won't touch you because they don't want to have any liability on if you damaged your teeth or not. But it does look like he did get a dentist to take the brackets off and polish them off and go ahead and put a permanent retainer on there, which I'm assuming probably cost him a little bit of money too. But in this situation, it does seem like it worked out okay. Still wouldn't recommend it for everybody though. Let's check out the comments. Somebody said, OMG, did you do this yourself? And I'm assuming he did. I mean, he could have been working with that dentist and maybe they placed the brackets on for him to do it and I didn't even know about it. But from what I see, it does look like he did it himself. And on the other side, somebody said, please don't do this. You can damage your roots. Go to an orthodontist. And I didn't even think about that. Not only can it cause bone loss, if you move teeth too fast like that, the roots can actually blunt and actually get shorter. And if they're shorter, they're not in the bone as much and they get loose and they wiggle and eventually they can fall out if it's too severe. And that brings up another point, is you don't know what's going on with your own teeth. We look at x-rays, we look at all these things. Some people naturally have super short roots. And so if you're moving teeth that are naturally short, you could eventually lose that tooth if you move it too much. So he didn't even know what his teeth look like probably with an x-ray to see if he even should, if he had periodontal disease or anything else going on. That would also harm his teeth when moving them. And lastly, at least he's not super encouraging of people. Somebody else said, can you do this for bigger gaps? And he said, I would. So that's good. At least he's not trying to tell other people to do this because it'd probably be a bad idea. But let me know, would you do it yourself or would you maybe just trust an orthodontist? All right, you guys tag me in this. Some girl, oh my gosh, her front teeth just fell right out of her face. What the heck? What is going on here? Okay, I'm trying to figure it out. Ah, okay, I see what's going on. So these are what we call pontics. Now, as you can tell when they're just hanging there, there's just two empty spaces in the front of her teeth. And this is a very common practice that we do when we're doing braces on somebody with missing teeth. Now, it could have been a whole bunch of reasons. Maybe she lost them in an accident. A lot of times we see the front teeth missing because somebody landed on their face, especially like falling over a bike or something when they're a kid. And so, unfortunately, when we're doing the braces, you don't want to sit there with a giant wire across and just an empty space there while we're doing your braces to make the sizes correctly. And we can't put implants in because we don't have everything perfectly set yet. And so what we do is we use these plastic teeth called pontics and we put them in the gaps and we get them all molded and shaped the right way, and then we put braces on top of them so that they mimic and they basically meld in with the rest of your braces so you can't tell that they're fake teeth. Now, the one big issue with this, especially in the front ones, is the second you go biting into something like an apple or something, if you forget, well, this exactly happens. And if you play, you can actually see that they just broke, hang off and flaw. And then the other thing too is they kind of flip around too. We try and tie them down so they don't do that, but every now and then you may have a little mess up, and especially, hopefully it doesn't happen in the middle of a dinner like this, especially if you were on a date or something. That'd be pretty scary. I would go to the comments, but they're all in Vietnamese and I can't speak Vietnamese. So for now, I'm just gonna say, don't worry, she did not rip her two front teeth out, and more than likely, you're not gonna have to deal with this. And if you do have fake teeth and get a pontic, well, maybe just be careful of what you bite into, okay? Where are you guys taking me? Oh my gosh, I'm just, you know what? I don't even know what to say. You know, I'm not even gonna say anything. I'm just gonna go ahead and look straight into the comments and let you guys do the talking for me. Oh my God, I don't even know if I wanna read these. You guys are very savage in the comment section. Someone said, why can I smell it? Oh, well, I am not gonna lie. All that plaque and gunk that you have stuck on your teeth is one of the biggest causes of bad breath and halitosis. So I bet you that thing stinks. Somebody said the search being plaque and tartar removal. That would actually be a really good idea because this guy's in braces. He's gonna get all these white spots and nastiness, all this. That's basically one of the biggest issues I see in braces is people who don't clean it. All that plaque and gunk sticks there. All the bacteria poop out acid all over your teeth, and then you get these giant white marks all over your mouth, which is basically an early stage cavity. And so yes, he does need to go get a cleaning and get some of that plaque and tartar off. Oh my gosh, we got atomic breath from Godzilla and pearly yellows. Dude, you guys are savage online. But you know what? We listen and we don't judge. We don't judge. But for real though, if you're in braces, brush your teeth. You don't want to be walking around with stank breath, and you definitely don't want to get cavities all over your teeth, okay? Just think of this as a PSA. You know, a lot of your Hollywood stars out there get veneers because they don't like the look of their teeth, but do you know what veneers really look like? Well, we're gonna expose them in this video so you can actually see how horrific they are. Oh my gosh, no one prepares you for this moment before veneers. Oh yeah, trust me, I know exactly what I'm looking at. That is scary. Oh my gosh, that's intense. And this is actually what I'm talking to you guys about. You know, when looking at these things, a lot of people see the veneers, you know, they see the crowns. This is basically turkey teeth right here. And so what we see is the beautiful finished product, right? But you don't realize that you're actually getting all your teeth shaved down. And that's taking away, you're getting into the sensitive dentin layer. Food nastiness and gunk can get inside the veneers up into the teeth and start rotting them from the inside out. Not to mention, you now have 32 different items that can break in your mouth yearly. Anytime you bite down, chew, hit something, grind your teeth at night, you're risking breaking off one of these veneers and having to go in and get thousands of dollars more of dental treatment. So basically, yes, no one prepared you for that moment before veneers, but no one's gonna prepare you for all the moments after veneers. There's so much better ways of doing it now. We have 3D printing, we have prepless veneers, and we have, you know, this thing called braces to straighten up your teeth and make them look good. Oh my gosh, these comments. Someone said, is this a Labubu cosplay? I'm not gonna lie, she does kind of look like a Labubu though. They look like fangs coming out there. Someone said, as a dentist, can we stop normalizing this in 2025? For real. See, I mean, I've been talking about this for many a years, and hopefully I've saved some of you guys from going and getting the turkey teeth, but every day I still get tagged in videos of people making that grave mistake. Someone said, enjoy having dentures at the age of 35. You will feel sad when people have no sympathy for you. Enjoy eating through a straw in old age. And while that was a very mean comment, I mean, she was coming at her there. That was aggressive. It's kind of true. I mean, imagine this girl is 21. They're usually pretty young, the people that do that. All these veneers only last for about 10 years, and let's say that 10% of them fail, and maybe she doesn't brush her teeth very good. Well, then they can get in there and they can start killing off your teeth without you even knowing it. And most of the time you come back, and if you're not getting regular dental cleanings a ton, you will see and find that you have tons of decay in there. And yet you really could, by 35, lose all your teeth and go into dentures. Now, that's not on average what you see, but I mean, mind you, every 10 years you're gonna have to get these replaced. And if you're 20, that's at 30, at 40, at 50, at 60, at 70, you're gonna have to get them replaced so many times, you're gonna lose so many teeth because of this. And yes, overall, it was a terrible decision to do it, which is why I tell people, unless you have just some crazy nasty looking teeth, do not get the turkey teeth. Do not get all your teeth shaved down, please, 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 because once you do it, there's no going back. Okay, now this next video is actually a little bit of a throwback, because I'm not sure if you 2000s 20 kids will get this reference, but please let me know if you do, because it was something that caused a lot of pain back in the day. 80s kids biting foil with a cavity tooth. I know exactly what she meant. That is so true. And for the Gen Zers out there that have no idea what she's talking about, well, there's two pieces here that you need to know. Back in the day, our filling material was not white. It did not look like your tooth. And in fact, you can see out there. But those are not black cavities. Those are silver fillings that I got when I was like 10 years old in the back of my mouth. That's right, fillings used to be made of metal. We had mercury in them. They were an amalgam of sorts of different metals. Now that leads me to the next problem, is if you have metal in your mouth mixed with the saliva and minerals in your mouth, you can create what's called a galvanic shock. And if you have a metal on the metal with the saliva buffering it together, you would actually create an electric shock that would zing into your tooth and literally make you want to feel like you're about to pass out. In fact, I actually solved a couple issues where older people were coming in and they were telling me that it hurt so bad every time they would eat. And I would say, what do you feel like? It's causing, they're like, it feels like a giant zap is happening to me every time I eat. And I said, well, are you eating with utensils? And they said, well, yeah, of course I use a metal fork or a metal spoon. And I said, I got it, because they had a hilling on the outside, kind of like this one right here. You see that little hilling on the outside of the tooth? And so every time they would touch that metal fork or something to the back of their teeth or something, they would get a shock. And so it was actually a really common thing. Actually, when we were kids, we used to put up the big red wrappers in the foil and we used to chew on them, and you would call, yeah, it was a big mess. We like to cause pain for ourselves. I don't know why. To the comments, someone says, bro, gum wrappers found out the hard way, and some metal forks. See, that's what I was saying. I told you I wasn't crazy. 80s, I experienced this as an 03 kid. Well, that's actually pretty surprising. Actually, to be fair, they didn't really phase out metal fillings for, probably about 20 years ago. That's kind of crazy that 2003 was over 20 years ago. Oh my gosh, I'm getting so old. Is this what it feels like to be old? What does it feel like though? Well, Gen Z kid, it feels like somebody punches you in the face with Zeus's lightning bolt. Doesn't feel good. But well, luckily for you guys, the fillings are now composite materials, and that's the tooth colored materials, and you won't have that issue anymore. Although surprisingly enough, those old metal fillings were really good and they last a really long time. They form this little corrosive layer that like blocks in everything. It seals it in really nicely. Actually, they were really good fillings. I don't mind them at all. All right, how do I fix this without going back to the dentist? No borax. Oh my gosh, I just realized you would literally pulled off half your tooth. That's surprisingly how well that fits. You know, normally it's from someone trying to like pop open a beer bottle or do something crazy. Sometimes it's from falling over a bike or hitting themselves in the face. And so what happens is you can see that her tooth has chipped all the way in the center. Now, the number one thing you do not want to do is lose that little piece of tooth, because nothing fits your tooth perfectly like, well, your tooth. Now, so if you can bring that in, we can actually seal and put that back in using dental adhesive to get it in there. Now, she said, how do I fix this without going back to the dentist? Well, weirdly enough, super glue is probably your best option. I still wouldn't recommend it though, because we don't know how toxic super glue is, and it's probably just gonna break off. Again, I mean, if you really had to do that till you could get back into a dentist, I'm sure it would probably be okay. But still probably wouldn't recommend putting anything like super glue in your mouth, but that's probably how you would do it. Now, if she does lose that, we can still rebuild it up. It'll just be a different tooth color, and it won't actually be your tooth anymore. And so try and save that piece if you can. Another thing that could happen is if she really did damage that and break it off, sometimes you see the tooth turns gray because the tooth actually dies from the trauma. It's gonna happen like a year later sometimes. Shout out to my people with the gray teeth out there, you know what I'm talking about. Let's see if anybody has any insights in the comment section. Someone said, I know you said no glue, but probably glue. Yeah, I mean, I really can't think of any other way you could glue it back on there. I have heard of people using super glue to put stuff like that back on, but like I said, not my dental advice. I didn't say to put anything super glue in your mouth. It's probably bad for you, so probably don't do that. Girl, just grow it back. Man, that would be amazing. Can you imagine if we could grow back our teeth? I think there is actually a team in Japan that is working on growing teeth back, so that would be cool if that actually happened. So said, in all seriousness, go to the dentist now and bring that other piece. They can fix it. And she literally replied, I lost it. This is my one rule. Don't lose it. That's like the perfect thing you can do. Even if you could save it, they could put it on, they could make a mold of it, and it would make it the exact shape and size of your tooth. Someone said, just go to the dentist. It'll fix the problem without that much risk of going wrong. And it's true. I didn't even think about the fact that if you break too much off there, you can actually go into the pulp of the tooth. You'll know because you'll see a little red dot on the middle of your teeth, which means that you actually got into the pulp. Now, if that happens, unfortunately, the bacteria in your mouth can make its way inside and actually infect the tooth. So if we do see a little red spot there, she's gonna need a root canal and probably a crown to fix it. Now, if we don't see that, we can do a composite or a veneer or a crown or something like that. Or like I said, if she wouldn't have lost the piece, we could just stick that back on. But either the way, in the end of it, she'll be just fine. Okay, now I know you guys like white teeth and we talk about whitening stuff all the time, but I've never seen somebody do this with a whitening strip before. Am I the only guy who chews my whitening strips like gum to whiten my teeth? Did I miss that? What is he? Oh my gosh. Oh, that is disgusting. You can even see the foam. Yeah, my first thought on this is no. That's wild. That's wild even for me. I mean, one of the things that we try to avoid is swallowing hydrogen peroxide, and this is gonna definitely be something that I wouldn't mimic. That stuff tastes terrible already. I mean, that's one of the reasons why we invented our LumiSmart strips, is so that we literally couldn't taste the hydrogen peroxide and make it stick to the teeth and get it all perfect. Now, I mean, that's great. You do need hydrogen peroxide to whiten your teeth, but this just, it's a terrible idea. One, it's not gonna be in contact with all your teeth. You would have to chew on it and like leave it in your mouth for like 30 minutes. It's gonna taste terrible. And it's probably gonna make the back of your teeth super hypersensitive, which is another terrible idea. Surely the people in the comments are gonna agree with me on this one, right? Oh my gosh, I'm back. I love that I've become a meme on all these dental videos. It's actually hilarious. Someone said, no, because I don't wanna swallow hydrogen peroxide. And he actually said, well, just don't swallow it. And well, I mean, both of those options are nasty. I mean, if you swallow hydrogen peroxide, that's bad. And if you just keep this hydrogen peroxide, bleh, in your mouth and you're just keeping it in your mouth for 30 minutes, that sounds even worse. I hate whitening strips so much that in our LumiSmart, you actually can peel it away so it's only on the front of your teeth. It's actually the only whitening strip in the world that only goes on the front of your teeth if you want to. Well, you can have it both, but there's like a little peelable thing so you can stick it on the front. They're actually really amazing if you want to try and buy something nice. I fear this is just a you thing. We can hope. We can hope that it's just a him thing. And lastly, somebody said, I don't know, but your eyebrows are gorgeous. You know, people like my eyebrows too, but for different reasons. No, but seriously, after all that, I mean, just it's common sense. Don't chew on your whitening strips. It's a really bad idea. They need to go on your teeth, not into your intestinal system. This is what a real overbite looks like in my case. Oh my gosh. She is so right. And that's a big overbite. You see, what you guys don't understand is you've been calling overbites the wrong thing for a really long time. In fact, everybody always thinks that an overbite is how far it sticks out, and that's actually called an overjet. But this is a perfect example of somebody with a severe overbite, also known as a deep bite. And you can look at it in the front, and the way that we actually look at it is how much does the upper teeth overlap the lower teeth. And so normally we want 10 to 20%. If you get over 50%, you get into a deep bite. She's almost like 75, 80, so she's definitely got a severe deep bite. And the crazy part is, why does this happen? Well, it's because teeth want to touch other teeth. They want to grow towards teeth. And what happens is, if they feel like they're not hitting anything, they'll just grow downward like this until they can touch something. And then eventually they hit something, and that's where the deep bite comes from. In fact, if you look at her teeth from the side, you can see that her front four teeth kind of dip down, and they actually goes flat, and then those front four teeth goes woo. And that's actually, you can see where those four teeth had grown downward to try and find other teeth. Now, the way that we would actually fix this is in braces. We would put these things called anterior bite props on the back of her two front teeth. And then when she bites down, it would hit it, and it would push those teeth back up to being straight again, because they were up here and then they came down. Now we're gonna push them back up to get rid of that deep bite. That is kind of crazy though, because this is actually what an overbite is, because people come into my office all the time saying, I got a big overbite, and they don't. They have overjet. It's different. Someone said, I'd rather have an overbite than an underbite any day. And it's actually true. I would much rather have an overbite than an underbite. Underbites are way harder to fix than overbites. Someone said, my old overbite, god dang. Man, those are some big front teeth. That's an interest. I don't know if that's an overbite, but that's some beaver stuff right there. That's wild. Someone said, you can't even see my bottom teeth, where she responded, when I fully bite down, you can't see mine either, but I have those bite blockers to stop me from biting off the brackets. She's probably talking about those anterior bite blocks that I talked about. Ooh, and look at this. People are confusing overbite and overjet. They even have a little picture here that shows you. That's actually really cool, because that is exactly right. And just like that, we're at the end of our video. So make sure to like and subscribe. And if you see some videos popping up here and here, it's because YouTube thinks that you would like them, and you should probably click them and learn some more. And that being said, go to somethingnicecompany.com, support us with all of our amazing dental products that we've made for you guys, and we'll see you in the next video. Peace.